Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Ever get that feeling like you're trying to figure out your health, and it's like a puzzle, but the pieces just don't quite fit,
Oh, yeah, I know what you mean.
especially with something like multiple sclerosis.
Right.
Like you're talking to people or looking online, and it's just a ton of information, and you just feel like you're going in circles.
Yeah, and it can be so overwhelming when you're dealing with something as complex as the nervous system. Sometimes getting clear answers can be, well, really tough.
Yeah.
So I think that's why it's so important to really dive into the research, actually look at what the studies are saying.
And that's exactly what we're doing in this deep dive today.
Yeah.
We're going to be looking at a really interesting study that was done recently all about whether high doses of vitamin D can actually have an impact on multiple sclerosis, especially in the early stages.
Absolutely.
We've got a couple of sources we're going to look at. One is a summary from medicalexpress.com, which is a health news website.
Mm-hmm.
And then we've also got the actual research paper itself, which is from JAMA, the Journal of the American Medical Association.
Great.
So we're going to try to take all of that information and basically figure out, hey, could high-dose vitamin D make a difference for folks who are in the early stages of MS?
Yeah, and what does that even mean for people who are experiencing those first symptoms?
Right. Right.
What can they actually take away from this research?
Okay, so let's start by talking about this term, clinically isolated syndrome.
Okay.
Now, this is something that comes up in this study, and some listeners might not be familiar with it.
Mm-hmm.
So what are we talking about when we say clinically isolated syndrome?
Yeah, so clinically isolated syndrome, or CIS, is basically like a first episode of symptoms.
Okay.
And these symptoms, they kind of suggest there's inflammation or damage happening in the central nervous system,
Which is?
which is the brain and the spinal cord.
Okay.
So these symptoms could be a bunch of different things. They could be like vision problems, if there's inflammation of the optic nerve, weakness or changes in sensation because of issues in the spinal cord,
Yeah.
or even problems with balance and coordination if the brainstem is affected.
Oh, wow. Okay, so it can manifest in a lot of different ways.
Exactly. And the important thing to remember with CIS is it can be like a first sign of MS, but it doesn't necessarily mean a person will go on to develop full-blown MS.
Oh, so it's kind of like a warning sign, but not a sure thing.
Right, exactly. It's like an alert. And doctors will look for certain clues, to try and figure out how likely it is that CIS will actually progress to MS. So they might look for specific proteins in the fluid around the brain and spinal cord. They might look at MRI scans to see if there's a greater number of abnormal areas in the brain.
Okay.
And they might even consider the age when the symptoms first showed up.
So a lot of factors involved. Now, we often hear about vitamin D when we talk about MS.
Mm-hmm.
What's the connection there? Why is vitamin D so important in this context?
Yeah, that's a really important question. And we have a lot of evidence now that suggests that having low levels of vitamin D can actually be a risk factor for developing MS.
Wow.
And then in people who already have MS, having lower vitamin D levels has also been linked to more disease activity.
Oh, okay.
So it seems like vitamin D isn't just about, sunshine and healthy bones. It actually has a big impact on how our immune system works.
Right. So it goes beyond just bone health.
Exactly.
It's actually playing a role in how our immune system behaves.
Right. And that's super relevant for MS because we know MS is an autoimmune condition.
Right. So it's like the immune system is attacking the body's own tissues.
Exactly.
And vitamin D is kind of modulating that.
Right. And because vitamin D can influence the immune system, what we call immunomodulatory effects, researchers have actually been looking into it as a possible treatment for MS for a while now.
Oh, interesting.
But as the Health News article mentions, previous studies that have looked at giving vitamin D supplements to people with MS haven't always had clear results. Sometimes they work, sometimes they don't.
Right. So it's a bit mixed.
Yeah. And a lot of times those studies were actually testing vitamin D alongside other treatments like interferon beta.
Okay. So it wasn't always clear what was doing what.
Right, exactly.
Which brings us to the study that we're really focusing on today, the Delay MS trial. What were the researchers hoping to find out with this particular study?
Well, they really wanted to hone in on vitamin D and its effects. So they looked at giving high doses of vitamin D, but by itself, not with any other treatments.
Okay.
And they wanted to see if that could safely and effectively reduce disease activity in people who had recently had a clinically isolated syndrome.
Oh, so they were really trying to see vitamin D alone could make a difference in those very early stages.
Exactly. That was the goal. Could they change the course of what might become MS right from the beginning?
Okay. So how did they set up the study? What was the design of the trial?
Well, they used a design that's considered really strong in clinical research. It was a parallel, double-blind, placebo-controlled study.
Okay. Break that down for us. What does all that mean?
Sure. So parallel just means that the participants were split into two groups, and they stayed in that same group for the whole study.
Okay.
Double-blind is super important because it means that neither the participants nor the researchers knew who was getting the actual high-dose vitamin D and who was getting a placebo.
Oh, interesting. So no one knew who was getting what.
Right, and that helps to prevent bias,
Yeah,
Because sometimes if people know what they're getting, it can influence the results.
makes sense.
And then placebo-controlled means one group got the real deal, the vitamin D,
Hmm.
and the other group got a dummy pill. It looked exactly the same, but didn't actually have any active medication in it.
Got it. So they were comparing the effects of the real vitamin D to basically no treatment.
Exactly. And it's important to note that everyone in this study had recently experienced a clinically isolated syndrome,
Okay.
and they weren't taking any other medications for MS.
Oh, so they were really isolating the effects of the vitamin D.
Right, exactly. They wanted to see what vitamin D could do on its own.
Okay. So tell us a bit about the people who participated in this study. Who were they?
They were all adults between 18 and 55 years old,
Okay.
and they had to have experienced the onset of their clinically isolated syndrome within the past 90 days.
So very recent.
Yeah, very recent. And they also had to have certain levels of vitamin D in their blood at the start of the study.
Okay.
And while the sources don't give us the exact lower limit, it seems like their vitamin D levels were probably below what's considered optimal.
So they were likely deficient in vitamin D.
Right,
Yeah.
yeah. That makes sense considering they were testing a vitamin D supplement.
Okay, so tell us about what the people in the vitamin D group actually received. What was the intervention?
So the vitamin D group got a pretty high dose of cholecalciferol.
And what is that exactly?
It's a form of vitamin D3,
Okay.
and they took it orally. The dose was 100,000 international units every 2 weeks.
Okay, so a pretty substantial amount of vitamin D.
Yeah, definitely more than the typical daily recommendations.
Right. So how did they know if this high dose of vitamin D was actually having any effect? What were they looking for?
So the main thing they were measuring, what we call the primary outcome, was disease activity.
Okay.
And they defined that in a couple of ways.
Oh.
First, they looked at whether the person had a relapse.
And what does that mean in this context?
That means their CIS basically progressed to a confirmed diagnosis of MS.
Okay.
And the other thing they looked at was whether any new or contrast-enhancing lesions showed up on MRI scans of the brain.
Got it.
And they looked at this over the whole 2-year period of the study. So they were really looking at both clinical events, like a relapse, and changes in the brain that they could see on the scans.
So they're trying to get a comprehensive picture of what was happening.
Ex-
Okay, so let's get to the exciting part. What did the study actually find?
Okay, so the results showed a pretty significant difference between the two groups.
In what way?
So in the group that got the high-dose vitamin D, 94 out of 156 participants experienced a relapse or had new or contrast-enhancing lesions on their MRI,
Okay,
and that's about 60%.
got it.
Now, in the placebo group, 109 out of 147 participants experienced one of these events,
Okay.
so about 74%.
So more people in the placebo group had signs of disease activity.
Right, exactly. And the researchers also found that the median time it took for someone to have disease activity was longer in the vitamin D group.
Oh, really?
Yeah, it was 432 days in the vitamin D group compared to just 224 days in the placebo group.
Wow. So it seems like the vitamin D might have delayed things.
Yeah, that's what it suggests. It kind of pushed that disease activity further down the road.
Okay. And did they notice anything else when they looked at the actual brain scans?
Yeah, so they also looked at the number of new lesions that appeared and the number of lesions that showed contrast enhancement on the MRI.
Okay.
And both of those were lower in the vitamin D group compared to the placebo group.
Interesting.
So there were 72 new lesions in the vitamin D group versus 87 in the placebo group,
Okay.
and 29 contrast-enhancing lesions in the vitamin D group compared to 50 in the placebo group.
And just to remind us, what are those contrast-enhancing lesions? What do they tell us?
Yeah, so those are often considered a sign of active inflammation happening in the brain.
Got it.
So it seems like the vitamin D might have been helping to reduce that inflammation.
So not only was it potentially delaying disease progression, but also reducing the amount of new inflammatory activity.
Yeah, That's what the data suggests.
Now, I know they were looking at a lot of different things in the study. Did they find anything else noteworthy?
So they actually looked at 10 other clinical outcomes. Things like the occurrence of relapse alone, but none of those showed a really big difference between the two groups.
So their main focus was really on that combined outcome.
Right, the relapse or the new activity on the MRI.
Got it. Okay, now let's talk about safety.
Yeah.
They gave people a pretty high dose of vitamin D for 2 years.
Right?
Were there any concerns about side effects?
Yeah, so they kept a close eye on that, and what they found was that the number of serious adverse events was actually similar in both groups.
Oh, really?
Yeah. 17 in the vitamin D group and 13 in the placebo group.
Okay.
And none of the serious events were related to high cholecalciferol levels. So basically, the high-dose vitamin D seemed to be pretty well tolerated.
Okay, so that's good to know.
Yeah, definitely.
So based on all of this, what are the potential implications here?
Well, I think one of the most exciting implications is the potential to intervene really early in the course of the disease. You know, this study suggests that high-dose vitamin D given orally could be a viable option for reducing disease activity right when someone first has a clinically isolated syndrome.
So before it even progresses to a full MS diagnosis.
Exactly. And that's a big deal because it means we could potentially change the entire trajectory of the disease.
Oh, wow.
It really shifts the landscape of how we think about treating MS. You know, early intervention has always been a major goal, and this study suggests that vitamin D could be a powerful tool to achieve that goal.
And, it's something that's readily available and relatively inexpensive, which is huge.
Right, exactly. It gives people options.
Especially compared to some of the other treatments, which can be really expensive.
Absolutely.
And if it's reducing relapse rates and the formation of new lesions, could that actually impact the long-term course of the disease?
It definitely raises that possibility. You know, if we can reduce disease activity in those early stages, it could potentially slow down the progression from CIS to definite MS. And that could ultimately mean a better quality of life for people with MS.
Yeah, that's a really important point. Now, we always want to be careful about over-interpreting the results of any single study.
Of course.
What are some of the limitations of this particular study that we should keep in mind?
Yeah, that's a really good point. No study is perfect, and this one is no different.
Right.
So first of all, it's important to remember that this study only looked at people with CIS.
Okay.
So we don't know for sure if the findings would apply to people who already have established MS.
Right, so people who are further along in the disease course.
Exactly. You know, early intervention might work differently than treating a condition that's been around for a while.
Makes sense.
The second thing is this study only looked at vitamin D as a monotherapy. So it was the only treatment they were getting.
Right.
We don't know how high-dose vitamin D might work in combination with other MS therapies.
Okay, so maybe in conjunction with other treatments, it could have a different effect.
Right. It could be more effective. It could be less effective. We
Right.
just don't know.
Yeah, that's an important point.
And another thing to keep in mind is the very specific dose and frequency of vitamin D that they use.
Right, 100,000 international units every 2 weeks.
Exactly. So we don't know if lower doses or more frequent doses would have the same effect.
Right.
That's something that would need further research.
More research is always needed. Okay, so what about long-term effects? The study followed the participants for 2 years. Do we know anything about what might happen beyond that?
Well, the 2-year follow-up is a good start, but it doesn't tell us everything.
Right.
So we really need longer studies to understand the long-term effects of taking high-dose vitamin D.
Both the benefits and any potential risks.
Right, exactly.
Okay. And were the people in this study all from a specific geographical area, or did they share any particular characteristics that might limit how much we can generalize the findings?
Yeah, that's always something to consider with clinical trials.
Mhm.
So this study was done across multiple centers in France.
Okay.
And while that's good because it gives us some geographical diversity, it's still important to consider whether things like the participants' baseline vitamin D levels or their genetic backgrounds might have influenced the results.
Yeah, it's always important to think about how these findings might apply to other populations around the world.
Absolutely.
Okay, so let's bring in your expert perspective here. What are your overall thoughts on these findings? What really stands out to you?
What I think is so fascinating about this study is that it shows a clear benefit from a really simple intervention.
Vitamin D.
Right.
Yeah.
Vitamin D is readily available, it's relatively inexpensive.
Yeah.
And this study suggests that high-dose vitamin D could actually make a real difference in the very early stages of a potentially disabling disease.
Mhm.
The fact that it reduced disease activity both clinically and on the MRI scans is really encouraging.
Right.
And it kind of makes you think about vitamin D in a new way. Like, it's not just about bones. It's like it has this ability to modulate the immune system, maybe even turn down that overactive immune response that attacks the nervous system in MS.
Right. It's almost like a volume knob for the immune system.
Exactly. That's a great way to put it.
And earlier you were talking about how vitamin D can influence the immune system. How does that connect with what they observed in this study?
Well, if we think about how MS actually develops, we know that it involves this abnormal immune response that targets the central nervous system.
Right.
And vitamin D has been shown to affect different parts of the immune system.
Okay.
And it might actually help reduce the inflammation that leads to those lesions and relapses in MS.
So it's almost like it's calming the immune system down.
Yeah, exactly. And this study really adds to that evidence and suggests that getting enough vitamin D, even through high doses, could be a way to modulate that immune response early on.
And potentially prevent things from getting worse.
Right.
Now, this study raises a really important question for our listeners. How might these findings change how doctors approach CIS in the future?
Yeah, that's a huge question. Could early vitamin D management, being proactive about vitamin D levels, could that become a standard part of the treatment plan for people with CIS?
Right.
And what other research needs to be done?
Yeah.
We need to confirm these findings in larger groups of people, more diverse groups of people. We need to figure out what the optimal long-term dosing strategies are.
Right.
And we also need to understand how vitamin D might interact with other treatments that are being developed for early MS.
So a lot more to learn.
Yeah, definitely. It's a really exciting area of research.
It really is. So for our listeners, what's the main takeaway from this deep dive into the Delay MS trial?
I think the most important thing to remember is that this research provides really promising evidence for high-dose vitamin D as a treatment for early MS. But it's just one study.
Right.
And while the results are encouraging, we need more research to confirm them.
And just as importantly, this information should not be taken as medical advice.
Absolutely not. If you're concerned about your health, if you're having symptoms that might be related to MSA, you need to talk to your doctor.
Right.
They can assess your individual situation, consider your medical history, and give you personalized advice about diagnosis and treatment options.
It's so important to have that individualized approach.
Absolutely. And you should never self-treat with high doses of vitamin D or any other supplements without talking to your doctor first.
Right. Because it could potentially be harmful.
Exactly.
We always encourage our listeners to seek out information from reliable sources,
Yes.
like medical journals, patient advocacy groups, your healthcare team.
Right.
Staying informed is so important.
It really is. And on that note, I want to leave you with a thought-provoking question.
Okay.
We've seen in the study how a simple, readily available factor like vitamin D might have a significant impact on a complex neurological condition.
Right.
So what other factors, maybe things we haven't even considered yet, might also play a role in the early stages of neurodegenerative diseases?
That's a great question. It really makes you think.
Yeah.
So to recap, in this deep dive, we looked at a study that showed high-dose vitamin D can significantly reduce disease activity in people with early signs of MS. We encourage you to keep learning about this topic.
Yeah.
And always talk to your doctor for personalized medical guidance.
Right.
Thank you so much for joining us for this deep dive.
Thanks for having me.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.